My dad, Jim, died of Alzheimer's disease in 2016. In order to help pay for my dad's nursing home care, my mom had to reduce her already modest assets as part of what is commonly referred to as a Medicaid spend down. But what is Medicaid? How do you qualify for it? Who is it designed to assist? And why do so many people have to expend their life savings in order to get it? Today, I'm going to be taking a look at Medicaid. First of all, I need to give the usual disclaimers, and in fact, I want to amplify what I normally state. I am not an attorney. I am not a financial advisor of any kind. This video is for general informational or entertainment purposes only. You can consider the topics that I discuss to be research leads, just to help you as you are thinking through these issues and hopefully help to shorten your learning curve in some of these important topics. But nothing that I say in this video should be construed as advice of any kind. If you need actual recommendations and evaluations, you need to consult with licensed professionals in your area. In this case, you would be talking about attorneys who are knowledgeable about Medicaid or other Medicaid experts. These are the usual disclaimers that I attach almost onto any video in general. The usual disclaimers are especially important in the case of the topic of Medicaid. Number one, that's because Medicaid is just so complex. Number two, Medicaid's rules and regulations are subject to amendment and modification. Number three, eligibility and other limits can be expected to change almost annually. And number four, Medicaid has as many different variations as there are U.S. states. So you need someone not just who is knowledgeable about the rough contours of the entire program, but somebody who knows the nitty-gritty of your local situation, your state situation, and how best to advise you. But what is Medicaid? Medicaid is a United States government program that is designed to help impoverished people pay their medical expenses. Sometimes Medicaid is referred to as a joint federal and state program. Other times, Medicaid is referred to as a federal program that is administered by the U.S. states, and sometimes it's thought of as mainly a state program that has federal cash infused into it. The federal government generally provides funding for benefits that are mandated at the federal level, which makes sense. The states, in turn, provide administrative services, and they also pay for state-specific benefits. However you think of it, or by whatever name you call it, the reality is that Medicaid has a foot on the federal level of government as well as on the state level. And this is one key reason for its complexity. The particulars of how the plan is implemented and managed are going to vary according to the state that you're in. It's important to understand at the outset that Medicaid is a fairly broad program and can cover many different medical services. For example, it can cover routine doctor visits, it can cover hospital visits, and so on. Keep in mind the purpose of this channel. So this channel is focused on Alzheimer's disease and other dementias. Insofar as these kinds of cognitive impairments generally afflict people of advanced age, or seniors, and insofar as part of the services that Medicaid is able to cover include long-term care facilities, nursing homes, and the like of that, that is what I will be focused on today. But Medicaid can cover a lot more than that, and if you have need for that for yourself or for your family, I'm sure there are other resources that will expand on what I cover today. Because of the complexity of the topic, there are going to be a number of pitfalls, and I hope to point those out as we move along. The very first one is probably going to be this. It's easy to confuse Medicare with Medicaid. Not only are the two words very similar, but both programs are overseen by the same government agency, the Centers for Medicare and Medicaid Services, or CMS. Now, CMS is a major division of the United States Executive Branch Department of Health and Human Services, with the cabinet-level Secretary of Health and Human Services at the helm. But both programs differ in terms of who is eligible and what services are covered. Medicare is basically health insurance for seniors. Some of the premiums might vary in terms of the amount that's paid, but otherwise Medicare covers seniors of any income level. And here, senior simply means a person who is 65 years of age or older. There is an important caveat here. Medicare is called upon to deliver health coverage to people of any age, provided that they also are recipients of Social Security Disability Income, or SSDI, or if they suffer from end-stage renal failure or kidney disease. Now, Medicare itself is complex. Parts A and B cover hospital and doctor visits, respectively. Part D was added to help cover prescription drug coverage. You can talk about Medicare Part C or Medicare Advantage plans. And to complicate matters further, Parts A, B, and D can be further augmented with what is called a Medicare supplement or a Medigap plan. Although it does have a deductible, Medicare Part A is delivered premium-free to people who are fully qualified to receive Social Security benefits. Part A is often referred to as automatic in this sense. It is important to note that if you're not eligible to receive Part A cost-free, you may be able to purchase it. So Medicare is closely associated with the Social Security program. In fact, Medicare's eligibility age, 65, once corresponded to the full retirement age, or FRA, for Social Security recipients. Now, even though the full retirement age has been increased for most retirees, Medicare's eligibility age has remained the same. Medicare Part B is never free, though its actual amount of premium cost will depend on many factors, including your income level. Now, Medicare is not the subject of this video. Today, the topic is Medicaid, which, as stated from the outset, is the government's financial assistance program for impoverished people regardless of their age. So this is one quick way of distinguishing Medicare and Medicaid. Medicare has an age requirement, but no income requirement. As long as you're 65 years of age or older, you can be covered by Medicare. On the other hand, Medicaid has no age requirement, but it does have an income requirement. Medicare covers people 65 years of age or older of any income level, and Medicaid covers any age person, but only if they're of low income level. Now, I have an entire video on the question of whether Medicare covers long-term care costs, nursing home costs, and the like of that. Although there are numerous relevant details, the bottom line answer is presented to us by CNN. Long-term care and nursing home costs are not generally covered by Medicare. See my video for a more complete discussion. Suffice it to say that Medicare really only covers curative, skilled nursing care in a Medicare-approved facility. And even then, it only covers skilled nursing home costs, provided that your entry into a skilled nursing facility followed a hospital stay of at least 3 days. Additionally, Medicare coverage is calibrated to what are termed episodes of care, and each skilled nursing home visit is only covered up to 100 days per episode. So since Alzheimer's and related dementias are not episodic in the relevant sense, we can basically say that Medicare is going to be irrelevant for the purposes of long-term care and nursing home care spending. Another reason for this irrelevance is that long-term care is often bound up with what is called custodial care, and this is to be distinguished from skilled nursing care. Basically, custodial care is help with the activities of daily living, whereas skilled nursing care is what you would normally think of in terms of medical care. Medical testing, the administration of drugs, and the like of this. I have an entire video where I go into more detail on the distinction between custodial care and skilled nursing care. Now, it will turn out that for eligible recipients, Medicaid is able to pay many of the expenses associated with Medicare, as if things weren't confusing enough already. Examples of this would include the Part B premium, the Part A premium when it is applicable, various co-pays, and also Medicare deductibles. Each state sets its own guidelines for eligibility within various limits. In general, Medicaid assistance is available to people who are below, at, or near the federal poverty level, or FPL. For many states, recipients cannot have incomes that exceed about 130 to 140% of the FPL, adjusted for household size. And these low income requirements are very strict. In addition, Medicaid recipients are not allowed to have much by way of assets, or in the Medicaid terminology, resources. But these two financial tests, one pertaining to assets and one pertaining to income, are quite intricate. So much so, in fact, that I will be devoting a separate video to each of them. So in part 2 of my Medicaid overview, I will discuss financial eligibility from the standpoint of assets or resources. And in part 3, I will get into some of the information surrounding Medicaid's requirements from the standpoint of income qualifications. So I invite you to stay tuned for those conversations. If you found something of use, though, in this video, I ask that you like the video, subscribe to the channel, click the notification bell to be alerted to all the new content when it becomes available. I thank you so much for joining me today, and I look forward to seeing you again in another video. Thank you so much.